Hello and welcome to Wellness Watch, a show that explores the nuances and the burden of illnesses and diseases on mankind and how we in India are dealing with it. In the fast-paced lives we lead today, we often take our health for granted unless it gets too late. Some diseases even occur without warning. Cancer, one of the most dreaded diseases plaguing mankind, often attacks uninvited, without a warning or discrimination. So much so that it has become the second most leading cause of deaths world over. What makes cancer threatening is not its name, but how easily its early warnings are ignored. Today in Wellness Watch, we discuss cancer and its awareness. I'm Preeti Kaur. Cancer, a word that brings in fear yet inspires courage. Each year on 7th of November, India marks the National Cancer Awareness Day to remind us that awareness, prevention and early detection can save countless lives. With new breakthroughs like immunotherapy and growing focus on healthy living, the fight against cancer continues to advance. What causes it, what are the warning signs and how we can stay protected? Here's a report by DD India's Harshita Oberoi on how to never get cancer.
Every cancer begins silently. A small lump, an ulcer that won't heal, unexplained bleeding or sudden weight loss. Signs often ignored in the rush of daily life. Early detection is not just medicine, it's mindfulness. The earlier you act, the greater your chances to heal. Most cancers don't just appear, they develop from choices and surroundings. Tobacco, alcohol, unhealthy diet, obesity, pollution and viral infections like HPV can trigger cellular damage. Screening saves lives. Mammograms, pap smears, oral exams, imaging tests like CT scan, PET scan or MRI, blood tests and biopsies help detect cancer before it spreads. A diagnosis is not the end. It's the first step toward healing. Early testing turns fear into power. For decades, chemotherapy, surgery and radiation therapy have stood as warriors. Now, a new ally has emerged. Immunotherapy, where the body's own immune system becomes the soldier, recognizing and attacking cancer cells with precision. Each step is built on science and courage. Doctors, patients, and families fighting side by side for every heartbeat. The best cure begins before the disease. Quit tobacco, limit alcohol, eat plant-based foods, stay active, get vaccinated, and go for regular checkups. Health is a choice we make daily, and prevention is the promise we keep for ourselves and our loved ones. Among men, cancers of the mouth, lung, and prostate are most common. Among women, breast and cervical cancers lead. In children, blood cancers like leukemia appear more often, but many are curable with timely care. Awareness, regular screening, and family support turn fear into strength. Cancer may begin in the body, but victory begins in the mind. Choose awareness, choose action, choose life, because the fight against cancer starts with knowing how to never let it win. Harshita Oberoi's report, Wellness Watch, DD India.
All right, cancer continues to be one of India's most pressing health challenges, with millions of new cases emerging each year. According to the Indian Council of Medical Research, over 14 lakh new cancer cases are reported annually, and this number is expected to rise steadily in the coming decade. Despite medical progress, most cases are still diagnosed at later stages, where treatment becomes more difficult and survival rates decline. National Cancer Awareness Day is observed every year on 7th of November, and it draws attention to the rising burden of cancer and the urgent need for early detection in India. Today in Wellness Watch, we look for these answers. What is cancer? What makes it so dreaded? What are the stages of cancer? How is cancer detected? Is cancer permanently curable? And we also take a look at the medical advancements in India. Cancer treatment in India includes options like surgery, chemotherapy, radiation therapy, and newer methods like immunotherapy and targeted therapy. Now, the country has a growing network of specialized cancer hospitals with government initiatives like Ayushman Bharat Yojana providing significant health coverage. The specific treatment plan depends on the type and stage of the cancer. Up on your screens, we have institutes and hospitals which particularly cater to this. All India Institute of Medical Sciences, Delhi, Tata Memorial Hospital, Mumbai, Regional Cancer Centre, Kerala, Ram Manohar Lohia Hospital, Delhi, Postgraduate Institute of Medical Education and Research, Chandigarh. All right, to talk more about it and help us understand cancer better, we're joined in by guests. We're joined in by Dr. Gauri Kapoor, Director, Pediatric Hematology and Oncology, Rajiv Gandhi Cancer Institute and Research Centre, Delhi. She's also the Medical Director, Rajiv Gandhi Cancer Institute and Research Centre. She's joining us virtually. We're also joined in by Dr. Akhilesh Mishra, Department of Radiation Oncology, VMMC and Safdarjung, New Delhi. Thank you so much, both of you, for joining us this afternoon on Wellness Watch. Dr. Gauri, we've given a detailed report telling our viewers about cancer, but in simple layman terms, I would want you to start by explaining to us what is cancer and what makes it so dreaded.
Thank you very much. This is a very important question. So cancer is not one disease, but it's a group of diseases. The basic underlying pathology is that it is an uncontrolled proliferation of cells in a particular tissue and organ, which means break fail ho jata hai. Within each cell, there is a control mechanism which tells it how fast to grow and when to stop growing. In cancer cells, there is a damage to the DNA which doesn't allow them to understand when to stop. So these cells keep on dividing, they increase in size, however, they have no function. They don't work like normal cells. So they are growing, but they don't know how to function. And the other problem with cancer is that it spreads, it metastasizes. So these are two things which, when the cancer spreads, can become life-threatening. And even after treatment, some of the cancers come back, which is called relapse. So all these factors make cancer potentially fatal in many cases, not in all, but in many cases, and hence the fear.
All right, I'll take that forward to Dr. Mishra. Dr. Mishra, also help us understand how does cancer grow and spread, and for how long can a person have cancer without knowing?
Thanks for this question. This is a very relevant question because cancers of different body sites and different tissue origins have different ways to spread. Some cancers, they spread via bloodstream. Some cancers, they spread locally, invading the local tissue. And some cancers directly overpower the immune system and spread via lymphatics and other contiguous areas. So the main principle behind their spread is neovascularization. That means new blood vessels which sprout within the tissue, and they help spread the cancer. And the plentifulness of oxygen. So if they get enough oxygen, they will spread. So different cancers spread differently, and for example, those cancers which arise from bone marrow, they spread quite fast, and some cancers which arise in tissues which are not multiplying themselves very fast, like prostate, they spread quite slow. So some cancers, they might take just a couple of months to spread, like cancers arising from bone marrow, and some cancers might take even a couple of years to 1 decade to 2 decades, like prostate and carcinoma cervix. So the different cancers spread differently, and they spread at different speed. So there is not a generic way in which they spread or they take time. So it's a gamut of entire spectrum of cancers, and they have to be tackled separately.
All right, it's a gamut of cancers that has to be tackled separately. Dr. Kapoor, that was about growth and spread of cancer. But in the first place, how does cancer start? And also, when we showed our report, we did tell our viewers about how men have to face different kinds of cancers and women have to face different kinds of cancers. In our human body, what is it that makes some organs more prone to cancer?
So there are exposures, especially in adult cancers. There are certain exposures which are occurring every day. And these can be in the form of, various stimuli that our body is exposed to, which cause DNA injury. Within each cell, there is a DNA which tells us what to do and how to grow and when to stop growing. So this DNA injury, there is a mechanism in our body which normally causes repair. And whenever there is a DNA injury, it detects it, it clears it, it repairs it, and then allows the cell to divide. Sometimes there are certain DNA injuries which occur which are irreparable when they are so bad. So then there is a mechanism in the body called apoptosis. That means the body understands these are bad cells, they are not good for the health of the body, and they will destroy it. So what happens is that these mutations occur every day, and every day our body has a fantastic repair system and it repairs all of these. But sometimes what happens is that it overwhelms the body's surveillance. This is called surveillance. So it overwhelms the surveillance, and this cell may occur in any organ or in any body tissue. It may be in the liver, in the pancreas, in the food pipe, in the stomach. It could be in the blood. It could be really anywhere. It could be in the muscles. So depending where this abnormality occurs, and I will tell you the certain exposures like tobacco or smoking, like alcohol, certain viral infections like hepatitis, all HIV, all of these make our body system susceptible to damage. And when that damage comes to the DNA and it overwhelms the body's surveillance, the security system, which is all the time looking at these cells, and it is all the time trying to identify all the injuries in the DNA and repair it. It is happening all the time. And the moment it is overcome, then that is what is called cancer. It is a immune surveillance failure. And that's when cancer happens. Depending where it happens, that organ will have the cancer. If it occurs in the liver cell, it can cause liver cancer like hepatocellular carcinoma. And those who have liver cirrhosis or who have chronic hepatitis B are more predisposed to get liver cancers. Just for like an example.
Right.
Same way if someone is taking smoking, then the injury is occurring in the lung, and the lung is then more predisposed to injury. If someone is eating tobacco, then the lining of the mouth, it is more predisposed to be injured, and often the insult is so severe that it causes cancer.
All right, Dr. Mishra, what are the early symptoms that one should look out for, and what are the stages of cancer, and when is it that the cancer becomes incurable?
That's a very pertinent question. Most common cancers of India have to be looked into this. So in India, the major cancers are of the head and neck region, and these are common to both genders. And in females, the major cancers are of the uterine cervix and breast. Then there is cancer of lung, and also GI cancers. So these cancers are concerned with our daily functions and our daily looks. So if there is a change in your daily habit which persists for long, I would say rather longer than 3 weeks or so, so you have to be concerned about that. And some things which we cannot ignore, like generally we ignore them, like bleeding from gums. So if this persists for long, or if there is any abscess or any non-healing ulcer which is persisting for longer than 2, 3 or 4 weeks, then we have to be concerned. Then if there is fever which is not subsiding despite taking antipyretic drugs, so you have to be concerned. If there is unexplained bleeding from any site in the body, or black discharge from in the stools, so one has to be concerned. If there is alternating diarrhea with constipation persisting for weeks, then one has to be concerned. A very big concern is sudden unexplained loss of weight over a period of couple of weeks or months without any reason, even if the person is eating normally. So that could also be hidden cancer in the body. And of course, there are obvious symptoms like chronic cough or persistent headaches which are not going, persistent headaches with flashing of light, and also in some brain tumors, generally the patients face an aura. Aura is a kind of unexplained intense smell or visual stimulus which happens before a seizure, or which in common language we call epilepsy. So there is an entire spectrum, and one particular thing cannot be pointed out. But yes, if one is simply observant or simply vigilant, they can notice if something is amiss in their daily routine or daily schedule. So they must report to their local physician, and they might prescribe simple tests, and some cancers are detectable on simple blood tests and simple x-rays. And if there is something suspicious furthermore, so they can be subjected to higher tests like CT scan, MRI, PET scan, and biopsies, endoscopies followed by biopsies.
All right. Dr. Kapoor, is cancer genetic, and are there any particular age groups that are more prone to cancer?
So, most of the cancer in adults is from exposures. And in children, most cancers don't have a known cause. About 5 to 10% are genetic. So there is a small subset of cancers, and we say that there is something called familial predisposition. Like there are some syndromes like Lee-Fraumeni syndrome, in which there is a cluster of cancer cases in young persons. As you very well know, cancer is a disease of old age, but when there is a cluster of cases in the family, that means at age less than 45, we should definitely ask the family to go for screening and take genetic counseling, because if with early screening we can catch the cancer very early and save many lives. So there are certain syndromes. We have things like, there are many names, technical names, Bloom syndrome, Fanconi syndrome, Lee-Fraumeni syndrome. So there are certain genetic syndromes, but these occur in hardly 5 to 10%. And in adults, more than 70 to 80% are because of exposure to environmental stimuli, like I spoke to you, tobacco, alcohol, viral infection, radiation exposure. Even treatment with radiation and alkylating agents, these can also cause cancer. The exposures, those which occur with the exposures, they are preventable by modifying our behavior and lifestyle. Those that are genetic, by screening, we can detect them at a very early stage, and in both cases, therefore, we can save many lives.
All right, Dr. Mishra, to what extent does our lifestyle have a role in, in prevention from cancer? Ma'am did point out the external factors. What kind of good habits would you suggest to our viewers to prevent or to save ourselves from cancer?
Yes. Cancer, as we discussed earlier, they are very much dependent upon nutrients which they extract from the body. So in today's lifestyle, we are taking too much calories. So calorie epidemic is now rampant. So in today's world, this is a big lifestyle problem. We are eating too much, exercising much less. Then our circadian rhythm, the day and night rhythm, the daily rhythm is also disturbed. And of course, as ma'am said, people are taking tobacco, alcohol. So in the environment also, there are multiple toxins we are unknowingly taking in, like from plastics, microplastics, and then chemicals like benzyl chemicals and other chemicals which are there in soaps, shampoos, even food additives. So there are some things which can be avoided, there are some things which cannot be avoided. Then of course there are toxins in paints and other chemicals which we use in daily lives. So some things which are totally unavoidable, but things which can avoid, we can avoid are our lifestyle, which we can improve is taking food in a balanced way, exercising, if not exercising, at least walking a few thousand steps every day, and sleeping properly, sleeping enough, and sleeping on time at night, waking up on time, and then of course, then we can move on to further things
Right.
that restricting
So
things.
this is the
which
basic
affect our
bare
life.
minimum what
Bare
a
minimum we
person can do.
Personal hygiene is a very big factor.
Right.
In India, I would like to point out, in head and neck cancers, personal hygiene is a very big contributor, because personal hygiene means there would be small abscesses, and these small abscesses, they go for repeated injury, repeated insult, and these repeated injuries and insult make into a vicious cycle which might lead to cancer, which is a big reason. And in carcinoma cervix, as we discussed, uterine cervix, hygiene is the biggest reason.
Right.
Human papillomavirus makes cervix its home, and ultimately in a few years or in a few decades, it leads to cancer. So
Right.
hygiene is a very big issue, and we also have to be concerned with hygiene along with our daily lifestyle
Daily
modification.
lifestyle. All right. Ma'am, we did tell our viewers that National Cancer Awareness Day is observed on 7th of November. When we talk of India specifically, why is cancer awareness important in India? And what medical advancements have been made in India with regard to treatment and with regard to, world-class medical facilities that are available to the world when we showcase India as a medical hub?
So, for India, what is very important is that awareness is lacking. And the second very important thing is that patients often present in very late and advanced stages, just because either they don't get diagnosed, or they are so fearful of the diagnosis that they try to take other indigenous medications which will not work for cancer. And there is a huge burden of cancer in our country. The cost of treating advanced disease is very high, and not only is it high, but the outcome is also poor. So government has now many schemes, not only the National Cancer Prevention, in which we have got the screening program for cervical cancer, but we also have the HPV vaccine, which now government is telling is to be given to all girls 11 to 26 years to prevent cervical cancer. That is going to be a big boon. So that awareness is important. Then if our general practitioners, they come to know the early signs of cancer, because as you heard, the initial test that is required for cancer diagnosis is a simple biopsy. It is not a very complicated test. But once it is diagnosed, if these persons are referred to the right institutions where cancer treatment is available, then the outcome is good, because we can catch it early. Now, the other thing to remember is that government, and not only government, but all over the country now, we have got advanced techniques, and we have got the schemes to support the treatment also. So as you said, the Arogya Bharat scheme is there.
Yes.
And it supports many patients across the country for cancer treatment in the various public hospitals in our country. And technology now, it is any new drug, immunotherapy, it is discovered abroad, it comes to India within few weeks and months. Earlier, it used to come in 5 to 10 years. So we have all the advanced treatments.
Yes.
But no advanced treatment can make advanced cancer diagnosis and its treatment easy.
So early detection.
Our mantra is early detection. It can save lives, and our general practitioners and our public need the awareness. And today I may tell you, we did a cyclothon at Rajiv Gandhi Cancer Institute, Niti Bagh, just to spread breast cancer awareness.
Right.
So this is
so
really
early
critical.
detection, yes, early detection and awareness are the key words. Up next, we'll have a quick rapid fire round. I will put in some myths for you, both of you, but I request you all to give very crisp answers. Eating sugar makes cancer grow faster. Dr. Mishra.
Per se, it is not true, but yes, if over a long period of time, a person's calorie intake is very high over a period of years, so this can lead to different cancers like carcinoma breast in particular and carcinoma colon.
A biopsy can cause cancer to spread. Dr. Kapoor.
That is not true. If you don't take treatment after biopsy, definitely the cancer will spread.
Cancer gets worse if exposed to air. Dr. Mishra.
No, this is a myth and I don't know from where it has come.
Deodorants cause cancer. Dr. Kapoor.
That is not true, but again, we don't know one deodorant from the other. They can have chemicals.
Reheating food. All right. Reheating food in plastic containers in a microwave releases harmful cancer-causing substances. Dr. Mishra?
Yes, it can release alkyl and benzyl chemicals, so we have to be watchful and we have to be careful about that.
Dr. Kapoor, a person having cancer treatment cannot live at home, work or go about doing usual activities.
Absolutely myth. Cancer patient is not infectious. Cancer patient does not spread his or her cancer to the next person. If he is physically able, he should go out and do all the normal things. If he has a job and his physical activity allows him, he should definitely continue with his job.
All right, on that note, we'll end this discussion here. Thank you so much, both of you, for joining us this afternoon and helping us understand cancer better.
Thank you.
So after this wholesome discussion, we did understand that awareness is stronger than fear. Cancer is not just a medical battle, it is a call to action. Remember, when awareness becomes habit, we move closer to a world where cancer is detected early, treated better and feared less. With that, we end this edition of Wellness Watch here. Till we meet next, take good care of yourselves. Bye-bye.